Special Edition.
Well, as the COVID cases are rising in the country, especially the Omicron variant, the Prime Minister today chaired a high-level crucial COVID review meeting. And in the meeting were present the Union Health Minister and the Union Home Minister as well. Now, the Prime Minister, in fact, reviewed the preparation on ground in this fight against the COVID pandemic. And here on Times Now, we are also getting you the inside track of what transpired during this high-level meeting. The Prime Minister emphasized that everyone should follow the COVID-appropriate behavior. The Prime Minister also stressed that we need to accelerate the vaccination drive for children. Now, the Prime Minister is also going to be meeting the chief ministers of the states through video conferencing, of course, to discuss the situation in their respective states in terms of preparedness in this fight against the coronavirus pandemic. Today, the Prime Minister reviewed the situation amidst rising cases, not just of the Omicron variant, but all the cases that are being reported in the country. And that's the Prime Minister's tweet. Right after the meeting, he, in that particular tweet, speaks about how he held extensive discussions on the COVID situation and how he reviewed preparedness of the healthcare infrastructure, the vaccination drive, including for youngsters between 15 and 18, and ensuring continuation on non-COVID healthcare services as well. Let's go across to our senior editor. Megha, that's the Prime Minister's tweet where he himself is informing that he took stock of the preparedness on ground and not just spoke about ramping up the infrastructure in terms of this fight against coronavirus pandemic, but also continuation on non-COVID healthcare services.
Yes. Those are a couple of important points, Swati. In fact, in this meeting, a detailed presentation was, given before the Prime Minister about the surge in cases that is currently being reported globally. And then, of course, the concern areas here in India. The Secretary of Health gave this presentation before the Prime Minister and also then briefed him about the various efforts that we have already put in place to try and deal with this challenge. But Prime Minister's, the instructions that he's given are quite clear. In fact, it seems to us that the focus area were three. One, the first instruction that the Prime Minister has given in this meeting is to ensure adequate health infrastructure at the district level. Remember, Swati, in the second wave, a lot of problems were faced by people living in the countryside, people living in the villages, in the far-flung areas where there was no adequate health infrastructure. And so this time around, the Prime Minister said that the focus needs to be on good infrastructure to be put in place at in all the districts, especially those who are, reporting high numbers. Secondly, to accelerate the vaccine doses in the adolescents. Now, 31%, Swati, of the adolescents here in India have already been inoculated with the first dose. Prime Minister says this has to go on the mission mode. Now, why is he saying that? Because the data is telling us, and the experts are cautioning the government, is that, a lot of these children in that age group from 11, 12 to about 18 are coming up with severe symptoms. And they seem to be affected a little more than how adults are being affected by this particular variant. So they need to be protected first. He has also said that, all of those non-COVID essential health services need to go on, because last time around, that got hampered really badly. In fact, there were premier hospitals who had stopped taking patients of any other diseases and just went on handling COVID. That is not to happen this time around. The Prime Minister has also himself said that he's going to sit down with the chief ministers, all the concerned chief ministers, especially those states, where the numbers are high. And he would want to sit down and assess the state-specific scenarios and what are the best practices in this public health measure that can be put in place. So all of that has to be done in days to come, and Prime Minister will keep reviewing the situation.
All right, Megha, thank you very much for getting us the inside track. We also have experts joining us. Let's open this up.
You're watching the News Hour Special Edition, Debate #1 on Times Now, Super Prime Time.
We are joined by Rajib Dasgupta, member, National Task Force, and Dr. Rahul Pandit, member of the Maharashtra Government COVID Task Force. Good evening to both of you. I want to begin with you, Mr. Dasgupta. The Prime Minister has just chaired a crucial meeting. He tweeted about that and, in fact, has pretty much outlined the focus as far as this fight against the pandemic is concerned. But how do you assess, the situation? Because the transmissibility rate of the Omicron variant is very high. Many experts believe that in the mid of Feb, we'll maybe witness the peak in terms of cases. At this point of time, the entire focus is not just on ramping up the infrastructure, but also accelerating the vaccination drive.
Thank you. As far as strengthening the infrastructure is concerned, the central government put together the India COVID-19 Emergency Response and Health Systems Preparedness Package Phase 2 that has been in operation for some time, and the centre and the states are constantly working on this. So infrastructure is significantly strengthened now compared to some of what we saw last time around when the Delta surge happened. But what's important is that this is the Omicron variant, or the Omicron-led surge is a situation where the number of cases is not that important, because it's going to rise almost astronomically, the number of hospitalizations by which we should monitor. Now, what is relevant for India is, learning from the South African experience, the peak incidence has been in the age groups roughly of 40 to 60 and 60 plus, those who are working, mobile and so on. Compared to this, in the younger age groups, the incidence per million population has been roughly 1/6 or so. This is also an age group in our country which has a pretty high prevalence of non-communicable diseases, hypertension, diabetes, etc. And therefore, what happens in terms of outcomes and complications in this group is watch for. Second, there is still a substantial or significant proportion of population who haven't received 2 doses yet. That's something we watch for. Among the pregnant and lactating women, that group, again, vaccination is relatively low. That's also something we need to watch for.
Absolutely. Dr. Pandit, as far as Maharashtra is concerned, the situation at this point of time seems a bit grim. Over 40,000, just a little above 40,000 cases have now been reported in Maharashtra. As far as the government is concerned, some restrictions have been revised, but we're not looking at a lockdown, at least at this point of time in Maharashtra. So how is the government preparing, or the authorities preparing, to deal with the surge which is being witnessed?
Good evening. You're absolutely right. At the moment, the government is keeping a very close eye on both the aspects, which is looking at the occupancy rate of the hospitals, looking at the occupancy of ICUs and oxygen beds, is something which we are actually watching very closely rather than the test positivity rate. The infrastructure ramp up is being done across the state. In Mumbai especially, we have got a large buffer of the jumbo units. We've got almost 7 or 8 jumbo units which have at the moment been fully activated. And we have most of them are actually empty at the moment, and that's where the bed available ratio is showing that we've got more than 75% beds which are still vacant. Similar sort of infrastructure has been ramped up across the state as well. In small numbers, we are also helping out with tele-ICUs. We have a couple of centers where we are actually helping out rural hospitals or district hospitals or small hospitals in the rural areas to actually have some amount of advice from the city doctors if they require to on a regular basis and as and when required basis as well. I think this point was stressed well by the Honorable Prime Minister today in his speech, that we need to have the district level hospitals supported and the rural hospitals supported. What's going to be the challenge, and which is what we all need to be very, very cognizant of, is that the non-COVID healthcare services should continue no matter what. And that's where we need to have the healthcare infrastructure to be looked at very, very closely. We do notice that whenever the cases rise, the routine surgeries do go down, but the medical problems will still keep on coming, and we should be able to look after both of these category of patient, COVID as well as non-COVID. So at the moment, Maharashtra seems to be, yes, numbers are rising, it's concerning, but the healthcare infrastructure is not stretched at the moment.
Right, so you're saying the healthcare infrastructure, at least at this point of time, is able to handle this surge which is being witnessed. All right, Dr. Dasgupta, I want to bring you in on this particular point, because, whenever we speak about a surge in India, A lot of people also talk about the surge which is being witnessed in the European nations, in US, in the Southern African nations when the Omicron variant was detected for the first time. And of course, we are nowhere near that particular figure. There is no such explosion of Omicron variant cases or in general COVID cases happening in India. Do you think that the curbs, the restrictions that have been imposed now are going to have an impact and might curb the numbers at what we are anticipating the surge to be?
If I got your question right, my answer is as follows. First, that the South African experience, and remember South Africa's population is roughly that of the state of Karnataka. So in the South African experience, there was a real burst of cases. Everything lasted between 4 to 6 weeks. And the higher the urbanized the provinces, again drawing from the South African, the higher the peak of cases, but everywhere it lasted 4 to 6 weeks. But what's going to be very challenging for us, and we're already witnessing that, is the human resource challenge. With hundreds of healthcare personnel, hospital by hospital, being ill. Now, all institutions have prepared contingency plans. Therefore, these contingency plans are really going to be crucial, particularly as hospitalizations go up. Also, many, I mean, at this point it's difficult to say how many, but many hospitalized patients with COVID are also incidentally detected because all patients are subjected to a COVID test. They did not currently hospitalized, they did not necessarily admitted for COVID. And as Dr. Pandit very rightly said, that most states still have a lot of spare capacity. But what's really also going to be crucial are UP today, for example, had, but most of the cases actually came from Noida and Lucknow. And that's the kind of brunt that big cities, highly populous areas are going to face. And therefore, it has to be a very, very tailored strategy.
Right. Dr. Rahul Pandit, now what we also are noticing is the recovery rate. Recovery rate is improving and it is rapidly, in fact, increasing. The positivity rate is also high at this point of time. What does that tell you about this particular variant? I don't want to take away from the seriousness of the issue. Yes, people need to follow COVID appropriate behavior and they need to mask up when they step out. But what does that tell you about this particular variant?
So if we believe that the current wave, which is sort of showing 90% plus patients who are asymptomatic and the recovery rate, which is in the high 90s again, we would probably be wanting to think that this is all Omicron variant which is going on. But we still don't have genome sequencing in details of all the cities across the country. I'm sure there is a mix of Omicron plus COVID plus the Delta variant which we have seen. And I agree with you. I think this whole narrative that it is a mild disease is being played out too loudly. I think, yes, it is causing asymptomatic disease or mildly symptomatic disease in majority of people, but there's still vulnerable population, which Dr. Rajib just enumerated some time ago, unvaccinated, the people who are transplant patients, dialysis patients, patients who have comorbidities. We are seeing that they are requiring hospitalization. And it is only 2 weeks into the rise in the cases in Mumbai and Maharashtra, and Delhi is sort of following closely behind. I think we need to wait for another week or 10 days at least before we can make an assumption that we are not seeing that much rise in the hospitalization. I mean, there are two ways of interpreting this, that large number of patients are coming with oxygen problems, or sheer number of patients are so high, but the fraction of patients which are actually coming are still making it as a large number, and the hospitals may get overwhelmed with that. I think in both the scenarios, the hospital systems could get stretched. And I think that's why we need to have a tailored approach. I completely agree with that. And we also need to have a very good emphasis on home care. Home care, again, the Honorable Prime Minister talked about home care. Absolutely. I think home care is going to be the key in this third wave which India is facing right now. If we can have a structured home care program for most patients, most importantly, give them the red flags when they need to come to a hospital so that we can save every life. I think that's going to be very important. Another one, last point which I would like to make is that at the moment,
and ultimately, I think it all comes down to us on an individual level. if we want to win this fight against the pandemic, if we don't want to burden our health infrastructure, our frontline workers, our healthcare workers who already have in fact been overburdened ever since the pandemic broke out in the country, what we have to do is to follow COVID appropriate behavior. On an individual level, I think if we practice some restraint, mask up when we step out, and wash our hands and the basic protocols, if we follow that, then I think that will make a big change. Thank you very much, Dr. Pandit and Dr. Dasgupta, for joining us on the broadcast with your views, and thank you for taking questions.